There's an incredible amount of priority as it relates to healthcare policy in the state of Maryland. One of the most significant things that's happening across the country and here in the state of Maryland is the process of Medicaid renewals, also known as Medicaid redeterminations. Now that the public health emergency is being unwound, or is unwinding, if you will, there is a significant effort across the country in all states and territories to do renewal processes for Medicaid participants. And that is true for the 1.8 million Marylanders that are served on Medicaid across the state. Our process here in Maryland talks about the renewal process over the course of the next 12 months. And our goal as a department, through a comprehensive communication campaign in partnership with our MCOs, is to ensure that every single Marylander that is eligible for Medicaid coverage remains covered. So as part of the renewal process, the department is committed to ensuring that every single Marylander that is eligible for Medicaid remains covered. That includes work on a daily basis that's focused in on partnering with our managed care organizations, the Maryland Health Action, community-based organizations, including community health workers, hospitals, provider groups, associations, to ensure that we get the message out to all individuals across Maryland on Medicaid, that they update their contact information through Maryland Health Connections so that when it's their time to re-enroll, that they do so. We're also, as a state, partnering very closely with our national partners at CMS to ensure that we implement other strategies and authorities as states to ensure that we keep as many people enrolled on Medicaid as possible through multiple different innovative approaches. Those things include everything from linking SNAP and Medicaid renewal to targeted outreach efforts to all individuals across the state of Maryland. One of the things that we saw that went really well in the first cohort of redeterminations is our ability for the first time to link SNAP eligibility with Medicaid eligibility. And by doing so, we were able to auto-enroll those particular individuals into Medicaid, or keep them enrolled into Medicaid, as we reviewed their coverage at the end of May. That resulted in about 5,500 individuals across the state of Maryland keeping coverage. And so it's opportunities like that, additional waiver authorities, that we're continuing to explore as a department to ensure that we keep people covered.